And what we'll talk about today are the concepts of herbal therapy. And if we look at your handout, so I can sort of orient you, the objectives are on the cover. So what are we going to do? We're going to look at the safety and the effectiveness of complementary medicines for a number of areas. So we're going to look at inflammation and chronic pain, hormone and non-hormone related cancers. We're going to look at the metabolic syndrome, coronary heart disease, and some selected psychiatric and neurologic conditions. So overall, what we're going to do is we're going to talk about what's a good product. How do you tell? What really works? We're going to talk about inflammation, what it has to do with disease. What can I take for my pain, both acute and chronic? What can I do for my arthritis? What can prevent, maybe, breast, non-hormone related cancers? We're going to talk about, does diet play a part in health and disease? Absolutely, and we'll chat about it. And then, are there products that will help my heart, lower my cholesterol, improve my blood pressure? We'll discuss some of those. We'll talk about products that will lower my blood sugar. Are there products that will help with my depression? We'll talk about those. Anything that can help prevent chronic disease? We'll talk about a few of those. And are there products that will help me sleep? Okay. And then overall throughout the day, I will talk about patient counseling for health promotion using foods, herbs, vitamins, and antioxidants. And I'm not going to specifically say to you and teach your patients this, but obviously everything I'm teaching you, you can turn around and teach your patients. All right, here's another medicinal tea, milk thistle. Now, milk thistle is a very good herb, okay? So you don't have this monograph in your handout, but there is some evidence that milk thistle can help support liver enzymes, okay? So if you are taking drugs that are heavily metabolized in the liver, like HIV drugs, psych drugs, some antibiotics, drugs for lowering cholesterol, the statins, you might want to add some milk thistle to your regime to help protect the liver and get the liver enzymes, the P450 system, working a little bit better. Well, there's firm evidence, though, that suggests that milk thistle can help decrease blood sugar and also slow prostate cancer development. So the evidence is different depending on what we're looking at for milk thistle. And then there's no evidence that supports milk thistle for improving liver disease. People with cirrhosis, people with hepatitis, adding milk thistle to decrease the process of the disease. There's no evidence that it actually does this. Now, when you are using a milk thistle product, you want to make sure that you're using a dry extract, and you want to make sure that it is standardized to 70 to 80% of the active ingredient in milk thistle, which is silymarin, okay? Now, the issue with a medicinal tea is that milk thistle is not water soluble. So, if you're buying a tea, isn't that mixed with water? So there's no benefit. So again, if you're going to buy things out there, particularly medicinal teas, you better do your homework first and find out if it is available and safe and worth anything in a tea. There are some warnings from Consumer Lab about companies making milk thistle, often contaminated with things that you probably don't want to take with your milk thistle. So these are some companies that got poor evaluations recently with their milk thistle. Okay, actually, Consumer Lab tested 11 products and 7 failed. So if you're going to buy some milk thistle, you really need to run the Consumer Lab report, take it with you as you go buy your products.